Hello, assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel, that is Dr. Jahangir Khan. Well, today we are going to discuss another very important chest X-ray. Till now, we have covered almost 9 to 10 chest X-rays with complete explanation and diagnosis. Now, in this X-ray, we will apply the RIPE criteria discussed in previous lectures. So, what do you see over here? So, in this X-ray, uh, rotation. First thing is rotation, inspiration, penetration, and exposure, already discussed in my previous X-ray. But I will go directly to the finding. It looks like the trachea is rotated to the right. This is trachea, and this has been shifted to the right. The trachea is shifted to the right. Do you agree with me? Answer is no. The trachea is not shifted. Actually, if you focus on the film, this is actually the film that is rotated. This is the spine, this is the left clavicle, and this is the right clavicle. Now applying the criteria of rotation, that the medial end of the clavicle, at the level of the clavicle, the medial end of the clavicle, the distance from the medial end of the clavicle to the spinous process at the level of clavicle, that the left side would be equal to the right side. Now over here you can see that the distance from the left medial end of the clavicle to the spinous process from the left side, and from the medial end of the clavicle, right clavicle, to the spinous process and the right side. Now this distance is more as compared to this. So this, the film is grossly rotated. Now the take home message from this chest X-ray is, before you comment on the rotation of before you comment on the trachea shifting, that the trachea is shifted to the right or left, the first thing is whether the film is rotated or not. This is the most neglected thing in interpretation of chest X-ray, and this is the reason that you think of wrong diagnosis, and this is the reason you advise more expensive investigation like CT scan. But this patient presented with the chief complaint of fever, cough, and shortness of breath. There are calcified lymph nodes as well. Can you appreciate these calcified nodules bilaterally? And there is an opacity that lies in the right upper zone. Can you appreciate this opacity? Keeping in view the patient history, that is 100 peak year smoking history. Now this is very important. 100 peak year smoking history. Yes, this patient was having a 100 peak year smoking history, along with the weight loss. Patient presented with a significant weight loss, that is 15 kg in the last 2 months, and also there is a decreased appetite, and the age of the patient is almost 70. So keeping in view the history, uh, the neoplastic lesion was on the top of the list, so we did a CT scan of the patient. So in this CT, you appreciate what? Can you appreciate this? So there is a rounded opacity with irregular margin. This is actually mass. This is a mass extended from the right hilum with irregular margin. Speculated border. This is called speculated border. Speculated border with central cavitation. So which carcinoma cavitate? This is actually a squamous cell carcinoma. This is actually a squamous cell carcinoma. So this is extended from the right hilum. Apart from that, in this patient, if you focus down, so what you appreciate, you can appreciate these ground glass opacities bilaterally, plural based. Can you appreciate these opacities? These are actually not very dense. So bilateral and plural based GGOs. This is actually a picture of COVID. So a COVID patient can present like this, and this was actually a patient was also having a productive cough, shortness of breath, with frequent admissions in the last 2 years. That was actually the patient was having a COPD, chronic obstructive pulmonary disease. Can you appreciate these GGOs, ground glass opacities? So this patient was actually having a pneumonia, atypical pneumonia, most probably due to COVID, with the mass that extends from the hilum with speculated border. This was actually a squamous cell CA with atypical pneumonia. Thanks for watching. Please do subscribe my channel. Press the bell icon so that you get notification of my new video, and also subscribe my channel and share my channel. Thanks for watching.